Hi everyone, it's Bala here from School of Pharmaceutical Sciences USM. I'm absolutely delighted to get the opportunity to introduce the concept of geriatric pharmacy in this video. Before I go further, I would like to invite all of you to listen carefully to the following conversation between two older ladies that I've recorded previously.
Assalamualaikum Cik Mon. Lama kita tak jumpa dah. Apa khabar? Sihat ke?
Macam ni lah, duk keluar masuk hospital je.
Banyak ubat dalam plastik tu. Macam-macam color duk ada.
Itulah baru keluar awak ni.
Hai, sakit apa pula?
Hari tu sakit dada, mai hospital, lepas tu kena tahan.
Teruk ke?
Mana tak teruknya, tengoklah ubat ni. Ubat kolesterol ada, ubat darah tinggi ada, ubat sakit dada, ubat bawah lidah, ubat cair darah. Kenyang makan ubat je ni. Tak masuk ubat kecil manis lagi. Makan ada, cucuk pun ada.
Nak buat macam mana Cik Mon? Ni lah dia. Bila dah senja-senja lagu ni. Nasib badan.
Does the content of the conversation sound familiar to all of you? It is quite common to hear older people talking about their experiences and also the use of their medications. Most of them are simply taking all sorts of medicines, whether it is a prescription medicine, over-the-counter, or herbal and supplement, without really understanding the purpose of taking these medications. The question that we should ask ourselves as a pharmacist is how we are going to prepare ourselves to face these trends. As a healthcare providers or professionals who are recognized as the expert in medicines, it is our responsibility to prepare ourselves with the adequate knowledge, skills, behavior, and value towards the care of the older person. Let us look into the objective of this lecture. I hope by the end of this lecture, you will be able to describe the definition of aging and geriatrics, followed by understanding the complexity in providing optimal drug therapy to the special older population. Thirdly, we are going to understand the issue related to the medicines, particularly on the medication adherence. The last objective is to apply the knowledge on inappropriate use of medication in patient care. Let us dive into the first objective. The first challenge in addressing the healthcare need of a geriatric population is in determining what the term geriatric means. There is not a universally accepted definition. In general term, geriatric refers to an older person, but age is a relative descriptor. For example, the social and legal definition of an older population are often based on age. For instance, age 65 is commonly considered the threshold age for the geriatric population, and most healthcare literature criteria will use this definition. The FDA, for example, requires available clinical trial data for individuals over the age of 65 to be included as part of the required labeling for medications. The United Nations defines geriatrics as 60 years old, and most developed nations use a cutoff value of 65 and above. Regardless of the specific age threshold, it is important for us to understand that the overall health status and functional ability does not change immediately after someone becomes 65 years old, for example, or any other age, in a matter of fact. We must understand that physiological changes occur with aging are progressive, occurring gradually over a lifetime. The most important thing is we always remind ourselves that every life is precious and valuable. The healthcare need of a 100 years old adult is equally important as the need of a 40 years old adult or even a 5 years old child. We should have a clear mindset to ensure everyone is being treated accordingly without any bias. Just for your information, other terms such as older person, elderly, senior citizen, warga emas, warga tua are some of the commonly used terminology in the literature and daily life. The Malaysian National Policy for Elderly defines geriatrics as person older than and equal to 60 years old, which is in line with the consensus from the World Assembly on Aging in Vienna. Another terminology that you will come across is gerontology. It is the scientific study of the biological, psychological, and sociological of geriatrics. Treats the clinical problem of later life in older person. Another term that we should know is the aging. It is defined as a progressive, generalized impairment of function, resulting in a loss of adaptive response to a stress and in a growing risk of age-associated diseases. Aging is a continuous process. All of us, including you, are aging now while we are talking here. Obviously, the generalized impairment of function will be more obvious as we get older. This is an interesting slide for me. I want each of you to pause the video at this point and start to list down what you think immediately after looking at this picture. Many of us will highlight the aging process that can be seen as someone gets older. Wrinkles, skin becomes saggy, thinning of hair, blemishes, etc. All the answer you are listing is absolutely right. However, from now on, whatever you see in an older person, I want your mind to start think of the changes that is happening in their body, which may alter the way medication acts and the body reacts towards the medication that is being given to the older person. I want you to start think of the challenges they are facing as they get older and how you are going to help them to overcome their problem. I want you to get excited for getting the opportunity to treat an older person. Think of their feelings and emotions. How would you feel when you look yourself being old and being neglected? I don't want you to think older person will die one day so you can ignore their healthcare needs. Let's start think like a professional pharmacist. Let's look into some of the statistics in relation to the aging population in the world. The number of older person is increasing tremendously over the last decade. You can see that 12.3% of the total worldwide population are geriatrics, and these numbers are projected to increase up to 21.5%. 1 out of 5 person is predicted to be an older person by 2050. European countries are leading the league as we expected. You can notice this if you ever been to any European country. You can see groups of older person wherever you go. I was very happy to see them around. A similar trend is expected in Malaysia, where the 7% of the country's population consists of the aged, and it is projected to be 15% by 2045. What is the implication of these numbers? By the way, whenever you are shown a number, you should start thinking how it is going to affect you as a pharmacist later. We should always think for the benefit of our patients and must learn to work selflessly. Keep this in mind always. Now, let us come back to the impact of increasing number of older person to the healthcare system of the nation. Number 1, obviously it is going to increase healthcare costs. Number 2, it is the challenges to the healthcare providers. We will discuss this in the following slide. And finally, number 3 is on the quality use of medicines. By the way, are you thinking to this extent? Don't worry if the answer is no. You will slowly transform and start to think like a pharmacist later. Let us look why handling of older person is going to be a challenge for healthcare providers from the perspective of medicine use, obviously. The use of multiple medications or polypharmacy are very commonly seen among older people. This is mainly due to the multiple comorbid conditions that affecting them. Older persons are usually present with multiple diseases, and with the increasing evidences in the literature that supports the pharmacological treatment in this special population, I'm expecting more medication will be prescribed with the intention to either treat or prevent of the disease, and in some cases for controlling the symptoms, for example in diabetes. The changes in the pharmacokinetic and pharmacodynamic will definitely affect the drug response and drug handling in this population. I will discuss in detail about this in another video. Physiological changes that happen due to aging is going to add the challenges in the treatment option. I have prepared the slide on the age-related biological changes such as cardiovascular, central nervous system, renal, endocrine, and other conditions and uploaded in the Slideshare. You can find the link in the description section below. Cognitive impairment, increased risk of ADR, adverse drug reaction, drug-drug interactions, and medication adherence issues are some of the big challenges that we'll be facing while treating older person. These are the summary of the problems that can lead older person to be hospitalized or visit any healthcare professionals. As I told you earlier, polypharmacy is quite common among geriatrics. In our country, 1 in 5 elderly are taking at least 1 to 2 prescription medication, and up to 40% are taking 5 or more prescription medications. This number does not include OTC, supplements and other herbal products which are being used excessively by our people. If you look into the common types of medicine in the list, you can notice that cardiovascular agent and anti-hypoglycemic agent are the most commonly used prescription drugs by our population. Have you ever talked to an older person before and asked them about their medications? Please do that. You will realize that taking medication have become part of their life, and certain older person, and for those who are having cognitive impairment, it is definitely a big problem to them. That is why we keep highlighting that prescribing in the older person needs special care and consideration. Pharmacists can play an important role in assisting the prescribers by making appropriate medications and are given based on individual patient need. As I mentioned earlier, older person usually presented with multiple comorbidities. The prevalence of chronic illness among elderly in a rural community in Malaysia is 60%. As expected, cardiovascular disease, diabetes mellitus, and bronchial asthma being the most commonly identified. These are some of the symptoms of medication-related problems that is commonly observed in older person. You can notice that all these symptoms can also happen due to aging itself. Can you differentiate between drug-induced confusion and confusion that are caused by dementia, for example? In fact, this problem can lead to a scenario called prescribing cascades. The message is very clear. We should gain enough experiences and knowledge in order to treat older person. Let us look what is prescribing cascade is. You can see that often new symptoms caused by a drug go unrecognized and require the addition of another drug to the patient in the existing therapy. Let's assume a patient is given drug 1 and later they develop adverse drug effects. This can lead to addition of drug number 2 when the adverse drug events interpreted as new medical condition, and this cascade can go on and on if you don't stop. These are some of the examples of prescribing cascades. Let's assume that an older person visited a clinic with a complaint of knee pain and he was prescribed with an NSAID. We know that NSAID can cause increase in the blood pressure, and this can be misinterpreted as patient is having hypertension and being prescribed with an antihypertensive agent such as hydrochlorothiazide. Hydrochlorothiazide can cause increase in uric acid level in the body and can cause gout. Let's assume that the patient was given allopurinol for gout treatment and later the patient developed skin rashes. Let me stop here. Basically, we can avoid this cycle by just stopping giving NSAID for the knee pain in the first place. Can you all imagine now the complexity in treating an older person? This is another example of prescribing cascade. Pause the video and read the content of this slide carefully. Have you guys heard the term Geriatrics Giants? These are the 5 major problems commonly faced by geriatric patients. The first one is intellectual impairment, mostly due to cognitive impairment. The second commonly seen are incontinence. The most common are urinary incontinence out of this incontinence. Instability can cause falls, which are one of the most common problems in the older people. Many studies have been done in this area. Immobility is another condition where older person will start having problems in moving around and also cannot perform any activity of daily living. Diseases like Parkinson, stroke, heart failure, COPD can actually exacerbate these conditions. The last problem is iatrogenic, which are illness caused by medical examination or treatment. In fact, many experts are propagating medication-related problems as the 5th geriatric giant now. Just a quick recap on polypharmacy. It can greatly increase the risk of drug interactions and also increase the complexity of regimen given to patients and increase the cost of medication regimens. In addition, polypharmacy also can increase the occurrence of adverse drug reaction and hence affect the patient adherence towards medications. Do you know one of the reasons why older person end up with the use of multiple medication with the same medications? The answer is simple. Jumping from one clinic or pharmacy shop to another clinic. Have you done island hopping in Pulau Langkawi or Pulau Perhentian? Quite a similar thing here, but unfortunately, the so-called clinic hopping will cause more harm than benefit to the patient. How we can solve the polypharmacy issue? Very simple. Stop the medications. Of course, medication that is not needed and inappropriate to the patient is the one we should stop. We call it deprescribing. It is a systematic process of identifying and discontinuing drugs in instances in which existing or potential harm outweigh the existing benefit. So any drug that is more harm as compared to the benefit, we should stop the drug. Within the context of individual patient care goal, current level of functioning, life expectancy, values and patient's preferences. There are many guidelines have been published in guiding the prescribers to perform deprescribing. I will discuss about deprescribing separately in another video. This is a big topic for me to cover here.